Every day I'm hustling. Every day I'm hustling. Every day I'm hustling. Every day I'm hustling. Every day I'm hustling.
Ladies and gentlemen, welcome to this week's episode of What the Health Just Happened, where we talk about all things healthy versus not healthy in healthcare, community, business, and life. The goods, the bads, the ups, the downs, the lefts, the rights, and everything in between. We bring in a variety of guests, again, to talk about all those topics. Today, I'm fired up for today because we're going to hit community and healthcare. Before that, I have to thank our sponsors, 212 Benefits. Of course, hi, Mom. I love you. Every episode I say hi, Mom. A lot of words here. Jacksonville. Say it. Introduce yourself.
Jacksonville Speech and Hearing Center.
Jacksonville Speech and Hearing Center. Mm-hmm. What's the acronym? Because we're going to start using that.
JSHC.
JSHC. Nonprofit doing some incredible work in the community, which, again, I promise we're going to address all that. Chandra Manning. I want to say that right, because when I talked to you earlier, I said Chandra. It's Chandra. Like
Jackie Chan.
Like Jackie Chan. I love nicknames on the show. She said that. I'm like, that's going to stick. Chandra, welcome to the show. Chief Operating Officer, soon to be
CEO.
Chief Executive Officer. We like claps in here. Bom, 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 bom. Congratulations.
I'm stoked.
That's awesome. Well deserved, too.
Thank you.
So much to cover, including this show's live, right? It's Saturday. What's Saturday? It's Wednesday, by the way. I love saying that. It's not live. But yesterday, when people hear this on the radio, will be your 75th anniversary.
Yes, big number for us. Very excited about all of the work that we've done in the last 75 years. We are officially older than Disney. And for those of you who are local, Rex the dinosaur on Beach Boulevard.
Oh, I love Rex. You know Rex from UNF.
I do.
So you're older than Disney,
Yeah.
Older than Rex. That's crazy. 75 years.
Mm-hmm.
That's Friday. Again, these are numbers that you told me. You went from your first year seeing 4 patients, and this year you're on pace to see
More than 6,000.
6,000 people
Yeah.
in Northeast Florida or just
Northeast Florida, yeah. So we serve Duval and all the surrounding counties.
April 19th is Jacksonville Speech and Hearing Day. Did you know that?
It is, yes. We
I
have
pulled that
our
from the
own
website.
proclamation.
I don't think people know about that, though.
I agree. I don't think people do know about it, but it's our day. We
It is
earned
your
it.
day. You've earned it, as do all the kids and adults that do it. So who are you? What do you do? Right, you in the business. For anyone who's not familiar with your organization, great company here locally. Who are you? What do you do?
Well, we're nonprofit, so we're here to serve the community. We do speech, language, and hearing for individuals of all ages. Whatever your needs are in that area, you come to us, and we figure out how to make it happen.
Say it again. Speech, audio. What was the third?
Speech, language, and
Language.
Hearing.
Hearing.
So audiology.
Audiology.
Yep.
You know what audiology means?
No, I do.
Eyes and ears. Age group. So when you started and were founded, was it directed towards children specifically, or?
It was, yeah. We were actually started by the Junior League, who just celebrated their 100th anniversary.
They're older than you guys.
They are older than us, and they were the ones that started seeing those 4 patients, and then it went on from there. We've had our ups and our downs. There was a point I think it was about 10 years ago where we were about to shut down. We were not going to be able to serve the community at all, and through the support of locals here in Jacksonville who came together and a new CEO, we came back from that. And like I said, now serving 6,000 patients
That's a
this year.
lot of people. Is
Yeah.
it based off fundraising, like money coming in?
A lot of it's based off of fundraising. We do accept insurance, so we take most insurance plans and we'll work with those. But we have a lot of fundraising efforts that we do, especially our big annual fundraiser
We're
in
gonna
May.
nail that.
Yes.
We're gonna nail that. I don't know if we should talk about insurance because, like, I work in that space and I talk a lot of trash about the space that I work in. But
It's pretty frustrating.
It's frustrating.
It is.
Well,
Yes.
let's-
I mean, it has pluses and minuses, right?
Let's go positive first before negative. So you're serving all different ages. How are you servicing them? Right? How do people find what you're doing? How do they get in touch with you? Who's a good patient or family member? Like, my child needs this care.
Oh, yeah. And I think a lot of children need it that families don't realize they need it. When my kid was young, she had a little bit of trouble with her R's. We thought it was hilarious. We would tell her
Yes.
at family gatherings, hey,
Say this word.
I parked the car at Harvard Yard, exactly. And then we would all laugh because she couldn't say her R's. We just didn't realize that it was a struggle for her. And I think a lot of parents, are in that mode. They're like, oh, it'll happen. It'll come for them
It's
later.
cute.
It's cute right now. Yeah.
I'm guilty.
And then again, you don't realize the snowball effect that has, right? She struggled to read her first couple of years. And we just didn't put two and two together. I didn't realize it until I was in this field. But that's where a lot of families are. They just don't know it until you know, right? So as far as like a good patient, I think we're looking at people who are just trying to figure out where their hearing is, where their children's speech language is, just curious about getting a baseline, figuring out where you're at.
So what are some of the signs that a parent would look for that would kind of... What are the signs that a parent would
Did you
look
ask
for?
that again? Was that mic off?
No, we're good.
Okay.
So the light come back
Hashtag
on.
no edits.
Yeah, what are some of
That's all right.
what are some of the red flags that a parent would come across?
So really interesting is that it doesn't present in the way you think it would. Like
Okay.
I said, my kiddo couldn't do R's and I didn't think much of it. But what I needed to pay attention to was that she was getting frustrated with her reading. She wasn't comprehending.
What age do you mind sharing?
Not at all. She was somewhere between 2 and 3 when we started noticing that she was
Okay.
having trouble with her R's, and it was really cute. And then when you get to the stage of reading, she started BPK in kindergarten, and she was frustrated and she was acting out.
Okay.
She would throw tantrums, and it seemed unrelated, but it was very related. And so it presents in different ways. A lot of it is frustration. You think a child is acting out or misbehaving when really it's a communication challenge, and they don't know how to express it. They don't know what they don't know. And so I say a lot of times that's how it's presenting.
Young kids. Like, and again, I would say our audience probably are young parents, if I had to guess.
Most likely, yeah.
So parent recognizes maybe a concern, then you all come in and do an assessment. What's soup to nuts?
Yeah.
They walk in the door, we do XYZ, and they leave the door, and bam, they're President of the United States of America.
Exactly. Just like that. I'm going to go home and tell my child that's her next job.
There you go. That's a lot of pressure, though. Look, terrible timing, too, an election year. Yeah. How about CEO of a really awesome company?
Yeah.
Okay.
Yes. But from start to finish, I think what you're really looking at is you start with your pediatrician. When you're a parent looking for services for your child, you always start with your pediatrician because they have the whole picture, right? And then they refer you to us. We're considered an ancillary healthcare service, not a necessity, which is something that eats at me.
Can I actually chime in on that? This drives me nuts.
Yes.
Hey, health insurance. We're going to do everything for healthcare except your ears and your eyes.
Oh, yeah. It's absolutely a joke.
And your teeth.
I was
Yeah.
going to say,
Who's that?
we forgot
Who's
teeth.
that? Yeah, teeth.
Yeah, we're just not going to cover you from the neck up.
Listen, your mouth, your eyes, and your ears. That doesn't qualify. Sorry. I hate to chime in, but yes.
Yes. So we get a referral from pediatricians. They come to see us, full assessment based on what's being reported. So like any field, there are 100 different things we could be looking at. So we're going based off of parent report, patient report, and then we do assessments that are age specific. And they're done by a master's level clinician, a speech language pathologist, and then scored. And you, from that, develop goals. Okay, these are the things that we need to work with to make sure that your communication skills are where they should be. So you're receiving and projecting, the information correctly that you need to be successful.
I'm actually glad you said that too, right? So recent growth, you said 10 years ago, you almost shut the doors.
Yeah.
Now you're in a growth stage in a good way. This is providing an incredible service to Northeast Florida, right? You went from 3 speech language pathology clinicians. These are master's and bachelor's level degrees.
Yeah.
And 2 audiologists, doctor level clinicians, to now 13 and 4.
Yes, in just 4.5 years.
Could you possibly talk about why you think you guys grew like that?
I think
What changed?
Yeah,
the
I
dynamic?
think that there are a couple of things that contributed to it. One are the challenges with insurance, which we don't like to talk about.
We call it Voldemort. I used to call it COVID Voldemort. Now it's insurance.
Now it's insurance.
It's insurance, yes. As reimbursement rates are not improving, a lot of places are no longer accepting insurances, and we feel it. Our community responsibility to accept those so people have a place to go. So we get a lot of calls. I can't go anywhere else. No one else will take my insurance. And we either look into getting credentialed with that insurance so we can take care of them, or we figure out some other financial assistance that will work for them so that we can take care of them. So insurance is a big part of that. We're seeing a lot more people come to us because they have nowhere else to go. We had someone come up from Ormond Beach the other day.
Wow.
Because they have nowhere else in their city to be seen. But COVID was a big part of this. I've shared with a lot of people that all of a sudden we had this huge influx of people needing to get their hearing tested. They say, I can't hear. But what people don't realize is that we all read lips. People with normal hearing read lips. So the second you cover your mouth,
oh my gosh,
people think they have a hearing problem. And so we got to the point where about 50% of the people we were testing had normal hearing. And
but
just
they thought they had
they had a hearing deficit.
Wow.
Yes. So that just got a lot more people to realize that the people that did have hearing loss, that they had hearing loss. Because on average, it takes someone between 4 and 7 years to address their hearing loss once they recognize it's a problem. But with that many people having a hearing loss, thinking they had a hearing loss, it just kind of got it out there, and people weren't so afraid to get out there and get it checked. And so we had a huge increase in that. And then the same thing happened with the children on the speech language side. They're home more. Parents are realizing that there are these communication challenges. They're learning over a computer, which for a younger generation is really challenging, even if they are more technically savvy than an older generation.
Yeah.
And so now there's just this realization that, we really need to pay attention to our children. And this is why they're falling behind in third grade reading levels and other things.
Man, I should have pulled this stat up too, but it's such learning. By the time you're in third or fourth grade, your reading level, speech level, like that affects the rest of your life.
Yes.
We've got young children, so this stuff's really important. You don't think about it. When I talk to them, like, I never thought about this. And again, God bless, we're fortunate we don't have these concerns, but a lot of people do. Mm-hmm. Workplace culture. I love talking about healthy cultures, healthy versus not healthy. A couple lines you said. Workplace culture is top notch. Everyone loves each other. Nonprofit and healthcare. We're paying clinicians less to do more.
That's absolutely true. We are paying clinicians less in our nonprofit healthcare clinic to do twice as much work. And that's because we work with lower paying insurances. We work with grant funders who have high expectations of what you're going to be able to do with their money. Understandably. And so, we are. And to combat that, although it should happen anyway, we work really hard at creating a culture that people want to be in. I mean, we spend how much of our waking hours at work?
A lot.
We should really be aware of whether or not we like what we do. And so we want people to like what they do. The people that we employ have huge hearts for the community and the work that they do.
You have to be built a certain way to work in anything in healthcare, right? Especially the nonprofit world, and to show up and smile and be grateful and excited. And we'll share some stories later. What was your journey? So where were you before you came on, right?
Yeah.
How'd you end up here?
I would say probably not a typical journey. I definitely never thought I would end up in healthcare, especially something so specialized as speech, language, and hearing healthcare. I did project management. I did some marketing communications, quality control. And when I was about 9 months pregnant with my youngest child, my employer stopped making payroll.
Oh, wow. Yeah, curveball.
Yes.
9 months, I'm just envisioning.
Yeah.
Yep,
9 months, yes.
First,
yeah, so quite visibly pregnant.
Yeah. Like a sneeze away from labor.
Pretty much. So at that point, I just took whatever I could find. And an audiologist locally here.
Can you share the name?
Her name is Dr. Nancy Gilliam, but she is retired now.
Well, we can still give shout outs. Dr. Nancy.
Yes,
Okay.
Dr. Nancy. Still one of my favorite people on the planet. Absolutely love her. But she gave me a chance, and she worked with a young mother, and I started out just answering the phones and checking insurance benefits and scheduling people. And thankfully, she saw the value in what I did, and I started picking up other things and really helped her to grow her practice.
We need more of these.
Yeah, buddy.
And
I love it. Keep going.
The world needs more of these.
The world needs more people who see the value in other people too.
There you go. True.
So otherwise, I wouldn't be where I am today. But she, like I said, she saw the value in me. Eventually, worked up to being a director of operations with that practice, and then when she sold and retired, had this incredible opportunity to come over to Jacksonville Speech and Hearing Center and do what I loved doing in the nonprofit world, which makes me love it even more. It's a no-brainer. And so here I am.
That's awesome.
Soon to be CEO. I'm going to keep saying that.
Yeah, let's go.
Yeah.
Your journey there, where did you start? Did you like, hey, I'm going to wear all the hats? What am I like? Because you're tied to the clinical side too, right? Aren't you the?
I am.
She wears all the hats.
I do. Well, I think that's a nonprofit thing.
Yes,
We wear all the hats,
Fair
right?
enough. Fair enough. Yep.
But I did. I started there as the director of operations and kind of took over. Same thing. Just whatever needed to be done. That's one of the things I love to do. Like, let's see what needs to be done. Let's get it done. Let's figure out how to get it done.
What can I do? How can I help?
Exactly. What can I do? How can I help? And took on HR and hiring and growing, starting new programs. We have a summer camp now. We have a mobile unit. We have a second clinic. So just wherever I could see the potential to grow and the potential within our clinicians and our administrative staff, just took it over.
You're raising your hand and doing it.
Yeah, like let's do it. Let's do it. Let's figure out how to grow these young professionals and administrative professionals, and the community need. It's there. So let's figure out how to grow us so that we can serve the community.
Culturally, right? The practice you worked at. What did you bring from there?
What I brought was what I was shown, and that was the ability to look at someone and say, they have so much potential in this area. Let's feed that.
Oh, I love that. I'm big on that.
Showing them how to do these other things too.
Yeah.
So feed what they're good at, feed their talents, love what they do, and show them that there's more.
You know mine?
That's how I was
the thing
taught.
you say, like, double down on your strengths.
Yeah.
Everyone's like, well, I got to improve my weaknesses. It's like, no, ignore those. Find someone who can sit in that seat and do that and double down on what you're good at.
Absolutely. And then you love what you do more, right? Because you receive all the praise because you're great at it.
It's a good feeling.
Yeah.
We got about 5 minutes left, plenty of time here. But so I'm going to read this first. I might butcher it, and I want you to just hammer this. We're going to say it this time after the commercial break multiple times. Where's my date here? So everybody mark your calendars, put it in the pin market, save the date, buy tickets, throw all your money at them. Signature fundraiser, May 11th at Timuquana at 7 p.m. It's called FinFest.
It is.
Right?
Ooh.
So this is your one event every year.
It is our signature gala. And it is not black tie. This is fun. This is put on
We like fun.
your flowery party resort wear
Nice.
and show up with your flamingo earrings and your pineapple pants. And
Okay. All right.
I like that, especially at Timuquana.
yes,
Timuquana Suite.
Yeah.
So this again, let's I mean, again, we got multiple time, plenty of time to talk about this event specifically. This is your one signature event.
it is.
How many people went last year?
I think we had 350.
350.
show up
That's
last
a
year.
That's a
Good
big
crowd.
event. Is there
It is.
live
It is.
music? Is there a
Yes.
silent auction? Like
All of the things
Tell us
because
the
it's our
things.
signature event.
It's a free commercial.
Yes, live music, always lots of fun. We have shrimp and grits. We have it's
so
outdoors and indoors, so all kinds of fun things to do. The silent auction is there. There are trips up for auction, which are always hot items. We have a
Yep.
big raffle item. That's fun. Cute little kids dressed up, walking around selling raffle items so that you cannot avoid buying them.
yeah, good luck saying no.
take it,
Yeah.
But we always feature one of our patient stories, at least one of our patient stories, which is the best part of the night. We're really excited about our kiddo this year. He loves basketball. He's going to receive his Talk of the Town award, and his mom has worked so hard to get him to where he's at today. So we're excited to be able to feature one of our kiddos who's just made so much progress every year.
Within HIPAA compliance, can you say his first name, or is that still a problem?
We haven't gotten all
Okay.
of the paperwork in place for it
forget
yet.
names. How about this?
If I had
Hey,
been
bud,
to that
how
point,
old is
yes. He is 4 right now.
Hey, 4-year-old mom, son, everyone involved. Great job. Congratulations. And you all for doing what you're doing. I love that. I love those stories.
That's super cool.
Okay. There's so much stuff to it. We'll hit fundraising again too. Tell me another story. We got a couple minutes here. You shared some really cool stories about a kid.
Could you share a story about maybe someone a little bit older?
We have all kinds of stories. So, well, one really interesting story, actually. We had an adult come in that was having trouble with speech and language after what we thought was a stroke. And I'm talking young adult in
20s, 30s.
Yeah.
Oh, wow.
Yeah, and just multiple strokes and kept coming in. And then one day, all of a sudden, came into therapy and was doing so much better. And it turned out that he wasn't having strokes at all. He was being mistreated. He had some other kind of really rare disease. But through like going back and trying it again and saying, hey, your speech improved rapidly, like this part's not normal. Let's look at it again. Like something else is going on here. So lots of encouragement from clinicians that kind of help you take those things back to your primary cares and your other specialists and say, let's look at this further, kind of thing. So that was a really interesting case that came in. Still needed speech therapy, but just to find that they had this really rare condition. Another one that was really interesting was we had an adult come in, and one of the things that we don't like to do is look in people's ears and tell them that they need to go see an ENT or a higher level clinician.
Go see someone else. Yeah,
go see someone else. Yeah, and then not really give them any detail.
Yeah.
That's a good point. Yeah, terrified.
But
You might have cancer.
Yeah,
Right here.
but
It's not, yeah.
yes, no, that actually did happen. We had a patient with an acoustic neuroma, so a huge growth in their ear on their auditory nerve that was causing their hearing loss. And because we told them to go see someone else, because they had been to their primary care was looking in their ear and wasn't able to identify what it was. But because they came to us for hearing loss, we were able to identify it. They had it removed. Totally clear now.
Completely normal.
Yeah, completely normal
Stories.
now.
We'll hit some
Yeah.
more stories in the back half. So, I told you it'd fly by, right?
Yes.
First half, gone. Chief Operations Officer, soon to be Chief Executive Officer. That's a fancy title. Chandra Manning, like Jackie Chan. I had to ask her that. I won't say that again. From now on, it's just Chandra Manning. Great first half. Hope you had fun.
I had a lot of fun.
You ready
Thank
for
you.
the second half?
I'm ready for it.
That's
Let's
what
do
the
this.
health just happened.
Every day I'm hustling.